Welcome in Homeopathic Canada live session, and today we have a special guest. So today our topic is a homeopathic talk on homeopathic experience. So we will invite and we will discuss today the experience, because experience is is something like that. You cannot bring these experience from only from books, but one author who write a book, he cannot he cannot write anything without getting the experience. So today we have a special guest, Dr. Jitesh Sharma from India, and he has a experience from last many years. He is in practice, and there's lots of difficulties we face whenever we are come out from college. College is one type of hindrance where you get the knowledge, but your patient tests you every moment, every step, what you gain, what you learn from these 5 or 6 years. Then your practical journey started. So today we have a general talk on how one person coming out from inexperienced background, and slowly when he face difficulties, how he get the experience. So I would like to welcome Dr. Jitesh Sharma, and we are going to talk on his experience and one of the very precious work on homeopathy, and this is the results of homeopathic experience. And I would like to over to Dr. Jitesh Sharma so he can introduce himself, and how he get and how he reach up to this experience, and a wonderful journey in field of homeopathy. Over to you, sir.
Thank you so much. And first of all, thank you so much for inviting me for this. And I am really grateful that today we are here to discuss my journey as well, and my experience and how I am treating cases. Really, I run a hospital here in Odisha, in India, and that's a homeopathic hospital. We do admit the patients. We don't give any saline and all. We totally use our homeopathic medicine. That's it. And we in basically in a very constitutional and classical approach. We are not into remix and polypharmacy, not at all. We don't follow that. No, like we practice strict on the Hahnemannian principles, and we as my what journey have started. Like I have been to so many teachers. Like I've studied under many stalwarts, and learning from so many people has boosted up my confidence enough to prescribe remedies by observing patients, by getting the right approach to case taking. And likewise, if I would say that if you treat a patient when you see in front of you, you should analyze him well enough. And this eyes, the strong observation plays a major role that what actually the patient is doing in front of you, what I have observed. So it is very important to understand the patient in front of you. Don't be in a hurry. Don't be in a jumble, because now current situation is like people are abusing a lot of homeopathic medicine and landing up to a place. So it's been worse now, because thanks to YouTubers and everyone who've been telling just for this condition you take this remedy, for this condition, this is actually spoiling everything, and this way homeopathy will fall down to a great level, and then there is no rising up. It's just a warning. And all these years I have experienced, and what I have written in the book, I have shown my approaches. I use LM, I use low potencies, everything. And my journey started when I had a case of pyroxia of unknown origin, and that case, actually he was under allopathic care. And my first case what I got, and he was suffering very bad. The temperature was 103, 104. And in spite of taking antibiotics and antibiotics for long, because it's been 3 months now, and he was like, he came with a cannula in his hand to meet me. And he heard that somewhere I am here, but I have learned from so many people, so let us visit. So he came to me with the confidence that I may be able to treat him. I also took up the case and I took the history and everything. So I asked him that how you got this fever and what the doctors are saying and everything. And I took on the investigation. I saw the WBC was quite high as well. And in spite of taking and doing the course, like he has taken 3 courses of antibiotics in 3 months, and still the fever relapses and it stays to 100 and 203. Even he took antibiotics through IV as well. So, being hospital to hospital, he was not getting well. So he came to me, and I took the history, and I got to know that he got fever after taking bath on a water park. On a water park. That was the history. That's it. And he got severe chills, and even sometimes gets a lot of bone pain in the back pain, and he gets restless as well. And seeing the WBC high and no medicine working, I gave him pyrogenum 200, and that one dose, that fever break off within 1 hour. And he was so happy, so happy. And he referred me a lot of patients after that. And because it was talk of the town, because since 3 months, because I live in a small town, so it was talk of the town that somebody, like, he was suffering since long, and that fever just vanished away in just 45 to 60 minutes. So it was miraculous for them. And that how I showed the power of homeopathy. That was my first case, and since then I have never looked back. Of course, I do have failures, and this is the reason I wrote the book. And the reason of writing this book is to show that even if we fail, we cannot give up. We cannot give up. Likewise, I'll tell you the current scenario. I'll tell you. Uh, the patient got admitted, a severe sciatica case. Let's talk about severe sciatica case. And the patient is excruciating pain. You take up the modalities, you take up the everything, and in the MRI, it's clearly written that is at all the nerve compression and the L5S1, there's a disc desiccation, everything you find that. And he is coming to you with a great hope that homeopathy can help. And in spite of taking all the painkillers and all the gabapentin and everything, he's not getting well. So what do you do now? So you take up his modalities, you take up his history, what he wants, how does he express and everything. So we saw the case and we took up the history. He wanted to marry some other girl. He could not marry, and he's suffering from 7 months. The pain is even the sciatica is with tingling, numbness, and everything. So we gave one remedy which just act as a partial one. It didn't relieve him, but few of the symptoms went away. And then suddenly, as we admitted the patient, he used to shriek with pain at midnight by 12, by post 12 to 3 between this slot. And and interestingly, he cannot even fold his leg, and he just screams that I have lot of pain, I have lot of pain, and especially that happens on night aggravation, severe. And he's very worried about his family, anxiety about his health, lot of health, and he keeps on complaining every day. I'm not getting better. I'm not getting better. I should get better. It's been so many days. I should get. So I was keep observing him, what he's doing, how he's doing. So at last I prescribed on everything on based on modalities and midnight aggravation. We gave Kali Carb LM. So we gave, as soon as we gave Kali Carb 0.1, 50% pain shut down. And then after 2 days, we shifted Kali. Again, he complained that there was been relapse. So I shifted to Kali Carb 0 by 2. Then he was better, better, better. Then again, after 2 to 3 days, he again complained that I had only one episode, but that was from 8 o'clock to 12. Now I don't have that constant pain, and I'm better, but I had only one episode. So I did okay. Again, I raised up the scale and I gave Kalikap 0/3. Okay. And as soon as I gave Kalikap 0/3, everything came down to normal and he went absolutely fine. So, this is what I'm trying to say here. If you're sure about the remedy, please scale up the potency. This is the first learning. What happens in this condition? You just constantly change up the remedies, you will lose the patient. At least if you're confident about that one remedy, please scale up and see. If the remedy is wrong, even if you scale up, you will not improve. This is a straight point what everyone should learn.
So,
And
yeah,
yes,
go ahead. Go
yeah.
ahead.
And LM potency is one of the biggest gift what Hahnemann has given to us. So please try to uh, like introduce LM potencies in your practice. You will see miracle results. What we have been doing. Plus, taking the case, the art of case taking is very, very important. What you understanding from the history and everything. You know, there are ton number of remedies. There are everything is given in Materia Medica. But to reach to that drug, unless you are very much confident about your case taking skills, you cannot reach to the drug. No wonder how much repertory you know. No wonder how much you Materia Medica you know. If you don't know case taking, you don't know nothing. You cannot do. You're just a handicap. So no. This is the reason I'm bringing this topic because I have seen people going crazy over the remedies and just running after repertory. If I learn repertory, I'll be the champion person and I will be a great practitioner. No, boss. You can become a great practitioner if you have a great skill to take up the case in a proper manner. That is the art. And that is the most difficult part because we fail there itself. And then and there we fail and we prescribe a wrong remedy in that particular situation. So please emphasize and try to improvise your skills in case taking rather than focusing on much more on mathematical and repertory. See, I'm not saying that that's not a part of our course, but that comes much later on. Being a physician, you try to improve your skill that how to take up because maximum juniors, many doctors and just come to me, sir, that patient is not saying anything. I cannot extract much information. What to do? So there comes a solution. You try to make up whatever important points, whatever points you are getting in that. And there comes the role of the history, the family history, the past history. These all points are very, very important. If you are don't considering, if you don't consider them, it will be a very difficult. And also the physical generals are very important. The thermals, whatever you take up the case. So these tiny informations plays a major role when the patient is not reluctant or is giving very less symptoms. Because somewhere or other, if you have that itch to get the remedy, you have to be smart enough to get all information. This is the main reason majorly don't homeopaths don't want to work hard and they just want to prescribe on basis of just few symptoms and just blah 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 and prescribe 4 to 5 remedies. I'm sorry, please, but I really don't think that is homeopathy. It is not homeopathy. You're just like superficial treatment, and that too in a long run it will do no harm because what happens after taking poly, that particular patient goes to another homeopath, and when another homeopath sees that picture, he that simply very happy. He sees that okay, he's getting that picture, na. He Rustox like picture. Prescribe Rustox, he'll be good. No, that is the biggest mistake. Don't prescribe on that. That is because of his remedies he has taken is showing that picture. So that is the problem. So please try to understand this is very serious issue what is going on in homeopathy. If you don't wake up, it will be too late, and sooner everything will be dead, and you won't be able to revive. I don't know how many people the voices goes, but this is the true fact. If you If you practice in a genuine homeopathy, you will definitely succeed much success than any other homeopath existing in this world.
So I include. I just want to share one case. How why people are show, because people having a show of personality. We have
Yeah.
something. We have lots of books. We have because I have seen in Canada, in America, in UK, in whole Europe, people having a show of habits. I have a one case, a small girl, almost 13, 14 year of age, having a whole eczema on the face, on the head, ear, everything is involved. And she is treated from last 4 year by a single homeopath. He gave her almost more than 100 remedies. More than 100 remedies. And when the patient came to me, I took the case, I write down all the symptoms, and I didn't give her nothing. And I told her to take 2 cups of coffee per day, per day. And after 1 week, I put this case on YouTube too. No eruptions.
Wonderful.
No eruptions anywhere. I didn't give any single remedy. I just give her a placebo and suggest her to take 2 cups of coffee daily. And in a week, the eruptions which is and not healed from last 4 to 5 years, she took every kind of steroids, every kind of all medicines, and she is treated in one week. So observation
It's very
is
important.
very important. If you having no habit of observation, you are not homeopath. This is true. You
True.
can get what you want to get. So today we have an experienced doctor, and I have lots of questions. So I just want to ask, and if any one of you, if the person who are watching this live session, if you have any questions, just ask directly, because discussion is only give you some fruitful results. And if you listen and forget after listening this session, you will not getting anything. So first, my question: how you get the idea to write the book?
Uh,
Because my experience with the Indians, because I have seen lots of book, they just copy paste and make a book. So why and how you decide to write the book?
my my father, Dr. Drishtop Sharma, he was like constantly asking me, "Ki Jitesh, why don't you show this? Whatever you do, why don't you show this to world, like what we are doing and how homeopathy, because it will gain up the confidence. It's not for the people, it basically for the students, because as he's very senior, he's like 65, 66 years old, so he has also seen that how young comers are just diverting, and they themselves are getting very underconfident that we are on the wrong track, we don't want to work, we just go and just work in allopathic hospital and just getting scolded. That's very bad. The scenario is so bad that so he told me that why don't you write it? It might at least see. I'm not a Superman or very like if I speak somewhere and I'm a very big person. I'm not that kind. Even if my contribution like 1% also contribution, and the any person reads the book and gets the confident, okay, I'm on right track, that is sufficient for me. I don't need more than that. This book is not for my self gain or I'm earning a huge amount of money after writing this. Please, this is nothing. This book is just for the readers who are desperate to work hard on homeopaths. So I wrote a book because of the original experience. I was actually thinking to write a clinical materia medica through my experience, but my master, my very close senior mentor, Dr. Manish Bhatia, sir. We were just chatting together. We met him, like I met him. So I told him, sir, I'm planning to write a book, and he said, Ki Jitesh, if you're planning for clinical materia medica, don't waste time. Why don't you publish original caseworks? That is very unique and very different. And I said, yes, sir, that's an absolutely wonderful idea. So he gave me that confidence enough that you just go and publish, it will be a huge success. So, and I did it. And touch wood, my all, like, it's going to be now third edition. So all first and second edition is all stock out.
So that's why uh, every single person who come out from colleges, there are lots of schools, so-called homeopaths, everyone having their own way, and they all put their own names. And I always says homeopathy is belong to Hahnemann. And if you didn't read Hahnemann, you are still having a lacking of information what you want to gain in your daily routine practice. So it's very hard to read and learn about Hahnemann, because Hahnemann give lots of work. He in his whole life he wrote down lots of book. He translate. And I have one formula: if you don't have any practice, if you are failed, accept it.
Yes.
You are not accepting.
You won't,
If you are failed,
won't rise.
you are
You
not,
won't rise. You
you
won't
will
rise.
never learn anything.
You won't rise. You won't learn. You'll be staying wherever you are, and ultimately you will sell a lot of patents in your clinic. That's it.
Yes. So accept it. When you accept, it means your conscious give you confidence to learn more. Because second thing, when you satisfy, I don't want anything more. I'm learned. When you say I'm learned, it means you are nothing. You
Yes.
are nothing.
Because a homeopath has to keep on learning until his last breath. And
Learn.
every day, patients teach us. Every day, somehow you will learn a lot of things through life, through patient, and that will actually help you to become a better homeopath. So you cannot become the best because there is no best homeopath in this
Oh,
world. Everyone is doing his best. But the question is whether are you doing your best with that patient? There comes the question. It's not about uh, just just prescribing. It's because if you ask yourself that whether you have given your best to treat that patient, there comes the question.
so
It's very easy to judge other homeopaths, but when it comes to you, you should be more confident enough that I have given my best. It's more than sufficient to realize. No wonder you have failed. But if you have given your best, you will learn a lot from that failure. And then the next time, if the case comes, 100% you will get success for sure.
I just want to share my experience. Always try to learn from home, because it's very difficult to observe what the people is around you, because
Correct.
sometimes you are not thinking like a doctor.
Yes.
My kid having a problem, and I failed 10 times because I think like a father, not like a doctor. So one day he was, because he has a stool collecting in the upper vertical intestine, large intestine, and he is constipated, and doctor did a ultrasound and said there is a collection of stool there, and he's not passing the stool, and still he has a pain in upper abdomen. Whenever he eat, vomit out, then the pain is reduced. One day he was sitting with me, and he eat a lot, and after that he said, I have a pain. Immediately he vomit out and come after and sit with me and eating again. I am shocked, because mostly When person vomit out, he's not eating immediately. And only single remedy is here, ferrum metallic.
Alikam. Yes. And that is the most important modality of this remedy.
I
Interestingly, the ferromet is the only one.
single dose is, I just select only on observation, didn't ask anything. Give single dose of this ferrum metallicum, and it's up to almost 1 month gone. I never repeat. Whole stomach is empty. Everything is gone. No pain, no vomiting, nothing. That's why observation is
Very.
so much, so much important. And why we failed? Because we didn't observe the patient. So now it's time to discuss one case. So we have lots of learners or even lots of students with us who just started their practice, because everyone having a big issue, and that issue is the selection of symptom. They collect everything. When they collect everything, they are confused. What is important, what is not important. So I just request you to explain one case, so they can, everyone can understand why and how the symptom of the patient is more important than any other one.
So, like, if you in a case, like for example, I'd start a case where case of you take a case of infertility. Simple. Now, case of infertility, already taking a lot of, they have taken all the allopathic drugs and everything, all OCP pills, irregular periods, and this case of PCOD plus infertility, and lot of suppression in that girl. And when the girl comes in like typical Indian attire, like then the husband, and also sometimes when the husband cannot come with the follow-ups, like mother-in-law comes with her, she cannot say much about it. Then you send the mother-in-law outside. Then you take up the case. Then you get a lot of information. All the suppression, the typical Indian, or what happens in society in a community. So these all things are very important. So likewise, we had a case and suffering from PCOD and infertility. So she was not revealing the information very easily. So we need to comfort her first. Then slowly she said gradual information came out, and she yes, my I'm very much dominated, and this and the issue was she was the follicles, the even irregular periods plus the follicles were also not yet developing. She was not able to conceive because of that, because the follicle could not rupture and that particular size. So we took all the symptoms and we see that she said that I'm being very dominated with the mother-in-law, and she was very sometimes she's weeping and sometimes very shy and very delicate. So when you see that typical behavior, you see the woman is very delicate and very shy, very polite, and very in pleasing attitude. She's sharing all the information, and we took this everything. We took all the thing, and we prescribe pulsatilla because of this delicate nature and everything and all the domination. And I only think what happened after pulsatilla, she got a bit better. She was taking the tolerance well, because when the husband shrieks, or she had a fear because she feels that if that mother-in-law has said some work, so she has to do. So she is that delusion neglected neglect his duty. So if you find you file pulsatilla is a very marked remedy. So what happens in this case taking, even if you take these all symptoms, you may see in the repertory chart 4 to 5 remedies. You know, it's okay to see 4 to 5 remedies, no problem. But don't be biased that the first one which is covering the most, it can be the see any of the remedies could be one. So don't be biased that the first remedy which is covering total, it could be the one. Open your Metamedica, then you evaluate the remedy, differentiate these probable remedies. Repertory is just a tool. It's not a guru or Bible who can tell you that this is the remedy you have to prescribe. Mark my words. It's just a tool. It's just a computer. Garbage in, garbage out. Whatever you feed. That on that basis you get results. So if you feed the symptoms which is not a high grade, you just feed and take up, you may land up to a wrong remedy on that for whatever remedy you're seeing. So you see what you give weightage on which is a more characteristic and what is more peculiar in this case. Weeping while narrating by symptoms, you see all the shyness, politeness. If you see thirstlessness, if you repetize that also in this, then you ask the sleep pattern, and they say I'll sleep in above under the hands, or all time I'll sleep like this. And on the fear, the delusion, neglected duty. If you do everything, so you'll somewhere you will come with lot along with pulsatilla and kali carb. You see silicia, sulfur. So whatever you see, and even if you repetize most of the symptoms, you take like 20 symptoms, then I'm sure you're getting sulfur only as a top remedy. So please, you take 5 to 6, 7 is also enough. It's enough, but take that precise symptom. It is not important to repetize on basis of 15 to 20 symptoms. Please don't do that mistake. You will land up on sulfur only. What happens? You start from head to foot. Whatever they're saying, you take head. They say there's no, then this whatever you select one chapter, you take one rubric. Ultimately, you'll end up on sulfur only. Keep on getting confused. What remedy has to be given? Actually, see the patient. What is wrong with her? Case of infertility. Her nature is very delicate. She's saying she's very dominated. She has been polite and she's been very much loving person in her in mother's family. In her own family, she was very adorable by her parents and everything. And she used to weep at little things, and she gets everything what she wanted, you know. And she's very hot patient. So pulsatilla people are the people. Even in winters, outside there is snow, they can wear a short t-shirt and they can roam around. This much hot patient is pulsatilla. So keep a note of it. Second, the shyness, the appearance, how they are talking to you, the way they are putting their symptoms in front of you. This catches the weightage. Now, for example, uh, if you ask somebody, like if you're asking somebody what are your fears, and if you put up the question and they say, I have I don't have nothing to fear. Like you give examples, you have anything which can actually make you scared of, and they'll be like some animals or insects, like what type of insects and what I'm, and they'll be like no, just a few small insects and over small insects or small animals, what animals? So be precise what animal you are talking about. Don't put the answer in their mouth, just keep on digging, and they'll say no, I have a fear of rat. So and they'll be like, you'll be like, fear of, then they'll rat. So what is the fear you get? No, if I see now, I immediately jump. This expression weightage, this confirms that she is reacting to this particular symptom. It has to be 2 to 3 plus, minimum 3 plus. This reaction, this energy which comes when their patients when express the symptom, when you ask if they express in this way, this contains a high grade symptom and it has to be taken. So answer to my this, and regarding the back case, the pulsatilla helped a lot, and after that came the role of nosode. Pulsatilla made of the menses and everything, but the follicle thing was not getting improved, which got solved by folliculinum, because folliculinum is also very much. If you read folliculinum Matermedica, all the restrictions, all the dominations you'll read, you'll get in folliculinum, and folliculinum 200 one dose was given, and after menses, and post we watched this after 12th or 13th day, the follicle came big and it got ruptured and she got conceived as well. So it has to be done very meticulously, what you're treating, how you're treating. It's not important that one remedy what you gave that will complete the cure. You may need further series of remedy to clear up the case, because nowadays you deal in complex diseases, not a fresh case you get all the time. All the time there is a mixed picture of many remedies. So you just keep paying. Don't be in a hurry to prescribe. You see the picture unraveling or you unfolding in your second prescription, third prescription. See, many cases, many acutes you can handle. Like nowadays, current situation I'm talking about in India, all the getting cough, cold, you get dalka mara, somebody's getting scrappy throat, cannot speak. So that covers by only HEPA sulfur. No other remedy can help that. I can bet on that because of treating so many cases I can see that. So if there is a scrappy throat, I'm precising again, scrappy throat feeling with soreness, you cannot, voice cannot come, and you're feeling like throat is scrapping with the cough, only and only remedy can help you, that is hypersulfur. And this all what is the virus going on? You can see Rustock's picture, Dulcamara, hypersulf, uh, even some kind of woofing cuffs which are lingering on, maybe Drosera, Mephitis. So you have to see the precise symptoms of that particular remedy in order to prescribe. If if somebody talks about trio of woofing cough, Drosera, Kali cough, and this uh, Pertussin comes to the top. Now you cannot be in a hurry to prescribe this like back to back. You have to see out of three which is matching the picture. Then you have to prescribe. You don't be in a like, okay, no, let's give Drosera today and tomorrow Kali Carb and third. No, you wait. If that fails, then you see again the modalities. Maybe you need pertussinum 1 dose and just clear up the picture. So this this is very important. This is all written by stalwarts. Whatever I have learned is all written by stalwarts, and all the books are available in the market. Everyone can read, and I always teach. I share a lot of things in my Insta just because of this, because I feel that whatever I read, I should spread to others. Everyone should learn. Why only I am learning? So this is my main motto, to encourage more homeopaths to learn, and wherever I get, like in major of the cases, I also fail. So I learn, and I whatever I learn, I immediately share through Instagram, and I show, okay, this remedy, if you don't get, you think of this remedy in this condition. So I have learned through a lot of my failures, and no one where there was what guide. No one can guide you. No one. Like in my time, I have been struggling and asking a lot of people, and everybody's like, just either you give this or that. So everybody has their own benefits. And the problem is, in our field, we are enemies of our own.
This
Okay.
is a big truth.
This is a yeah, this is no wonder how many will feel bad, but this is a fact. Very few people have a like-minded thoughts that, okay, let us grow together, and they'll share a same bonding with, okay, if Jitesh knows, he also, I feel, if I know, my one of my friend also should know. So I keep on sharing everyone. Arey bhai, I have learned this, or I have tried this, please you also once see, if something has happened, let me know, give me a feedback how it is. And he calls up, bhai, what a amazing experience you have. So this give and take relation is very important in homeopathy. Somewhere, see, everywhere in this planet, in the corner of the planet, you will see different kind of individuals. So if you get a case, you will if you get stuck, and that might be the case easy for me. So when you give this give and take relation, what happens, you will get an idea which is encountered by me as well, and you will give me something which you have experienced. This combination actually helps in treating patients in a more better way, because all we need is a clinical experience, and which has to be shared among other own homeopaths, not the clinical experience of giving polypharmacy, understanding patient very well, and how you're reaching to the remedy. That is very important here.
So
Not telling this product is very good, telling about the approach. Ki boss, patient said like that, and we think about like that, and this was a most peculiar symptom. Okay, so that way you learn the approach as well as you learn the remedy on the spontaneous whatever case discussion you had,
so
and this
don't
makes you a better person.
so don't think if you share, somebody is go ahead from you. No, no, nothing
Yes,
happening
yes.
like that.
No one
If
can take away your fate. Whatever fate you have, no one can take away your destiny. You
no
just
man,
keep sharing, and God will keep giving you everything.
have
If you don't share, you keep it yourself. That is none of the use, and you will die with your own whatever experience you have. No one would know what you have done in your life.
yes. So sharing always, because you're sharing when you speak, your ears listen that thing, and your mind remind that thing again and again and again. How many times? 100 times you share with the people, but 100 only 2 or 3 people remember this experience with their own. If they share with somebody else, because you remind this same thing 100 times, And what the person who learned from you, if he didn't share with this symptom or this knowledge with others, they will not get this information too long.
See, I have a complete ACL tear, and I'm still sitting in front of you. So I was supposed to get operated yesterday, but unfortunately I couldn't. So see, I'm always there for homeopathy, because when homeopathy is given so many things to me, I can give whatever I can. I have contributed my whole life,
So
and I'm so grateful to Hahnemann to gift us such a beautiful science. And whatever today is just because of Master Hahnemann, my father, my wife. So I have seen that if you have this giving attitude, you in return you will get so many things, so many things. So likewise, if you give your 100% to a patient being a homeopath, your result will be 100% successful.
So I give you one clue to everyone because we have short times, and I just want to share my experience. Anyone in what the person who are listening us, anyone, and he think I am failed. I got no knowledge. I have nothing. Read just one book first, and this book is this pathogenesis of the drugs.
Richard Hugs.
Read this book, and I definitely bet you will gain lots of information. After that,
The
you got. So second mistake people are did, they only attach with plant remedies or mineral remedies or this, and they forgetting the importance of no salt, sour course, and imponderabilia, because nobody teach you these valuable remedies, and these remedies is give you success when everything is failed. And a few days before, me and Dr. Jitesh talking on when somebody is failed, when some remedy is failed to act, and people think that if we give the remedy and that remedy didn't get results, it's failed. No, man, you choose the wrong remedy. You choose the wrong remedy. That's why that remedy didn't work on it. Failure mean you give remedy, and as Dr. Jitesh told you guys before, a few minutes before, when remedy acted and not able to finish the cure, this is called failure. In that time you have to need any miasmatic remedy, because that is the miasm. Because of that miasm, the symptoms are reoccurring again and again, and your remedy just give a momentary relief and not giving the exact cure. So where you need a second remedy. So this this is what we need today. We have to, first of all, we have to honest with ourselves. If we are honest with ourselves, then only we can give get something from others. Second, honest with others, especially your patient. If you are if you are doing mistake, accept it. If you are not accepting, it's you are not honest with yourself, and you are not honest with homeopathy. So I recommend every single person read this book once, and you will realize failure is the point where you get success.
is the
Because
key to success.
without getting failed,
You
you will not
cannot be successful.
not learn anything.
So I would like to share just like for everyone, whoever is watching, you can read one remedy called Proteus. Proteus has in chronic asthma of the old people.
Uh,
You're struggling with not getting clear.
can you spell it?
Proteus, Proteaus, Proteus. It's a bacillus nosode. So Proteus is an amazing when you struggle with the chronic asthma patients in the old people, in old people. then you can think of Proteus, which is not clearing up. So I'm telling, because as we are talking about the failures of the cases when the remedy don't act, so Sarko's no sorts comes to the rescue, and I'm so glad that we have so many remedies. We have so many remedies, and if you know the symptoms, if you know the art of extracting the right symptoms, you can definitely reach to that remedy for sure.
So I just inform you, everyone. I started a first course on no source because we have 74 no source, and after that we have a sarcodes and imponderabilia. By one and one we are discussing every single nosodes, every single symptom, and we will correlate how they are different from plants and minerals and any other medicines, so we can learn together, because reading is the only thing. When you repeat and again, you will learn. And what you are learning, when you see this information in patient, you will never forget in your whole life. So thank I would like to thank Dr. Jitesh Sharma, who give time to us in his hard time, because we almost postponing our session today because of his health, but he is still with us and he share his experience, and hope so you all get something, even a half point. If we say 0.01%, if you learn, then our discussion is very successful today. So thank you so much. Hope so we will meet together again, and hope so we share our experience so people can learn homeopathy in a Hahnemannian way, exact way, so we all together grow up and success. Thank you so much.
So much. Thank you, everyone. Thank you for joining us.
Thank you.